Hello again, and welcome to my week 4 presentation in regards to stigma in patients with schizophrenia receiving community mental health care, a review of qualitative studies written by Annalene Mesta and Bart Hansen. In the beginning, the intention for choosing this particular article was to find an article that related to a subject I would potentially use for the final paper, which involved choosing a film that provided equipment for living. So the film that I was going to choose, which I may change, but the film that I was thinking of choosing was related to mental illness. And also I have a family member, an immediate family member who has a mental illness and was diagnosed at one time with schizophrenia. So I was able to read through the article and kind of nod my head in agreement with some of the findings that Mesta and Hansen were able to come up with in their research just by being a family member and watching my loved ones suffer with the stigmas that society put on her because of her condition, specifically in high school and growing up in adolescence. The purpose of this qualitative review was to identify consistent themes related to the stigmas experienced by patients with schizophrenia who receive community health care. Now, according to their study, the patients with mental illness in general, not just schizophrenic, but just mentally ill patients in general, are no longer confined to a hospital setting like they may have been in the past or traditionally, where you would just go to your mental health facility and stay confined within the facility. But people with mental illness in today's society are being released to live normal lives like everyone else. But what the author is afraid of, or what they're trying to prove, is that the healthcare providers did not consider the social stigmas that their patients would encounter once being released out in the open with others who discriminate against them because of their condition, or who have stereotypes towards them because they have this mental illness. And the author feels that the patients are vulnerable to society because of the stigmas that they would have to face. So that was the purpose of the review, is basically to identify consistent themes that are related to those stigmas experienced by patients, but specifically with schizophrenia, who receive community health care. So in order to find out, or in order to research their topic, they decided to do some literature reviews. So they searched various sources, 3 from the Web of Science, PubMed, PsycInfo, and Francis. And they basically ended up with 3 themes which were identified that will be discussed in the results outline of the presentation. But basically their abstract is explaining a brief summary of what we'll be going over within the presentation. The authors began their presentation by explaining what schizophrenia actually is. So they define schizophrenia as a severe mental disorder with typical onset in adolescence and young adulthood. I found this to be true because with my loved one, it was between the age of 15 that she was diagnosed with the schizophrenic disorder. And according to research, is saying that there's positive and negative symptoms of the disorder. One of the positive symptoms, which is confusing that they would call it positive because some people wouldn't see it as positive, but it's categorized as positive. Symptoms of the disorder is hallucinations, delusions, and incomprehensible speech. The negative aspect of schizophrenia is social withdrawal, self-neglect, loss of motivation, and initiative. The other symptoms, or another form of the illness, which is indicated by the author is second illness, which basically is how society sees and the social labels that are related to the disorder. Because schizophrenia is the most stigmatizing of mental disorders. So you may ask, why is schizophrenia stigmatizing or more stigmatizing than the other disorders? Because no one wants to be labeled, according to my family member, as quote unquote crazy. So there's a lot of power behind the word crazy, and a lot of it comes behind ignorance, stereotypes, and negative beliefs about the illness. One example of a stereotype or just an ignorant thought about someone with schizophrenia is that schizophrenic people are dangerous, that schizophrenic people are incompetent, or that they're just strange. And these stigmas are not true. These stigmas have also caused the patient to withdraw from getting the treatment that they need because they are in denial about their condition. They refuse to take their medications and follow doctor's orders because they don't want to be the quote unquote crazy person that society tries to make them out to be. And even in my personal experience with my loved one, there were periods, of course, through adolescence, especially when you're a teenager, because you're specifically sensitive about your self-image and how others think you are as a person. So to have a stigmatizing condition like schizophrenia as a label, and just not feeling normal like the other kids, or having being able to function like other kids in school, seemed to bother my loved one growing up. And also, I did find that it was true that there was social withdrawal there because their self-esteem dwindles, self-neglect. You know, the loved one, my loved one, was always very conscious of her appearance. And after she got sick, she would kind of let herself go a little bit. She was a straight A student from grade school all the way to high school to the time that she got sick. And then, you know, once she got sick, she lost motivation and her grades just declined all of a sudden. So it's not true that that people with schizophrenia are incompetent or that they're strange. They withdraw themselves because of the way that they're treated in society when they're mentally ill. So although I can use my personal testimony regarding schizophrenia as a family member, the a scholar who is studying communications has to look at things differently. They have to base things off of research. So the authors here had to use research to back up a similar belief system. And they also have to provide a biased view to a certain degree because they have to evaluate multiple perspectives on the same subject. So in order to do that, one of the things they did have to weed out within their research is any views from family members or mental health professionals, so that it wouldn't interfere with the validity of their work. So again, Mesta and Hansen did a review of qualitative research on stigma with patients receiving outpatient community health care. And they did a systematic search of literature that was formed using the databases that we discussed earlier in the presentation. So in order to do this, they had to search for queries with keywords similar to what we had to do in our scavenger hunt project. So some of the keywords that they used to obtain various literary works was discrimination, schizophrenia, patients, mental illness, qualitative, are just a few of those keywords that were used. Of course, once they found those keywords, they would yield X amount of studies, and they had to find a better way to break the information down into smaller categories so that they wouldn't have millions of articles on one subject. So in order to do that, they had to break their results down into smaller categories Some of the categories that's listed within the article are categories involving concerned patients with schizophrenia, concerned patients receiving community health care, empirical research, and also concerned stigma experiences and or beliefs of these patients. They also searched for um, articles that were performed in or studies that were performed in the USA, Canada, UK, Europe, and Australia, but published in English. As a result of Mesta and Hansen's research, they were able to conclude the following about their hypothesis. Part of that is was broken down into a couple of categories. Stigma in the healthcare system was one of those. They found that patients felt they were discriminated against and not taken seriously by healthcare professionals. They didn't have a normal doctor and patient relationship. They were almost treated like children by their healthcare provider. They weren't given the appropriate information about their disease or their treatment. They weren't allowed to make decisions about their own health. If they questioned anything that the doctor said, they would be labeled as an uncooperative patient or troublesome. So if they went to another doctor to get a second opinion, it's already in their record that, they're troublesome. And sometimes they don't get results because it kind of follows them um, around everywhere they go. And when they visit their regular doctors, according to research, is saying that the patients feel that they have to wait longer than other patients in the doctor's office. And when they complain about physical illnesses or ailments that are not related to their mental disorder, they're still stigmatized as if whatever the condition is made up in their head because they're schizophrenic. So if your knee is hurting and you go to your chiropractor, he automatically thinks that you just made it up because you're schizophrenic. Okay, and so there's also within the healthcare system structural discrimination, which means that there's an impersonal approach, um, and it's hard to get a continuing, consistent care um, as a mental health patient in general. So a lot of times you may switch a lot of doctors, you may switch psychiatrists, so you have to retell your story over and over again. Okay. Under relational aspects focus on stigmas encountered on daily life. One of the stigmas were prejudice of violence and unpredictability. According to Hansen and Mester, part of this was because of media. Media influenced a lot of the stigmas that say that schizophrenic people or people with mental illness are violent, because when you look at the news and when you look at court cases, a lot of times they'll label the villain or the criminal as a mentally ill person or a bipolar person, a schizophrenic person that killed someone or robbed someone or went crazy and slashed everybody up. So that's basically where the stigmas come in with how they feel or what they found the stigmas were coming from as far as the violence, people with schizophrenia being violent. They also indicated, and this is something that our family had to learn, is family members. Family members have a tendency to treat mentally ill or schizophrenic patients with a paternalistic attitude, just like the healthcare professionals. So sometimes being protective and probably with good intentions, because I believed in our family, we had good intentions towards our family member, but just not wanting them to hurt themselves or to get into any trouble, you have a tendency to not allow them to make decisions or kind of treat them like they're children, or just being overprotective, even with good intentions, is demeaning to someone that is mentally ill who is an adult who wants to live a normal life. Discrimination in the workplace is something that my loved one experienced. People in the workplace discriminate against you because you're sick. They won't hire you, and if they do hire you, they don't have, they're not educated enough about your condition. They aren't trying to learn more about your condition so that they can help you to do your job. They may give you minimal assignments, and according to the research, this was one of the results that came up. So there was a low tolerance and lack of understanding of the illness in the workplace. And a lot of employees were discouraged to return back to work if they ever had to go to the hospital because they didn't want people to treat them different or um, to discriminate against them or to be the butt of someone's joke. But it also expresses the importance that people that are mentally ill have the right to work. They have to make a living like everyone else. And society kind of pushes them to the side as if, they're living in society like everyone else and they still have to pay their rent. They still have to, if they're able to drive, pay for their vehicles, pay taxes like everyone else. Because even if you're granted disability, it doesn't pay for everything. So a lot of people still have to work part-time jobs to make ends meet. Part of the behavioral aspects that were found in Mesta and Hansen's research were patients tend to withdraw from society, but they found in their study that this is mainly because of the way other people treat them or the prejudice that other people have towards them that causes them to withdraw from other people. And it did indicate that when a person with schizophrenia or a person with a mental illness finds a friend, it's usually someone that has a mental illness or some type of illness that can relate to them. But the only thing that is negative about that is that it limits the amount of social contacts that they have because they're limited to just people that are sick. So they're not getting to know a broad variety of people or a diverse variety of people because they're more comfortable around people that are like them, that have the same illnesses that they have, so they can relate to each other. As the discussion portion of Meston Hansen's literature review or their study on the stigmas against patients with schizophrenia, they did cover a couple of things. They spoke on the strengths and weaknesses of the systematic review. As a strength, they say the QALOG or the QUALOG log was the best methodological approach for the systematic review because they say that it found more information that was reliable. It was a people-aware, sensitive resource. The initial glimpses, concepts, and basic insights were gathered when using the method of systematic research. It was a strong tool when it came to comparing subjects because it eliminated the overlapping themes of subject matter, and so it helped to narrow down the resources for further research. One of the weaknesses of a systematic review in general is because it can use different methodologies from each individual paper. The results sometimes are limited to availability and the interpretation of the data within the research paper. Another part of the discussion was a biased view of their research. One of the results that they found about the stigma in healthcare is that a lot of healthcare providers are providing patient empowerment, and they are providing for their patients, allowing them to make decisions, and that they have a moral obligation to provide this service to all patients, not just mentally ill, but to all patients. And people are implementing this in the healthcare profession. So it may be that the perspective of a mentally ill person may be limited to the experience that they had, but it doesn't mean that all healthcare providers are negatively impacting a mentally ill patient. It also says, as far as social stigma, there have been cases where a mentally ill patient was moved by the notion that society treated them differently, and it angered them to a point of violence. So it is true to a certain degree that a person with a mental illness, or people with mental illness, have been put into situations where violence would occur, but it does not mean that all mentally ill people are violent, or that they that society should be afraid of them, basically. So it does provide a biased view of how people are treated, the stigmas against people with schizophrenia, and sometimes, as they say, or as they did discuss in the literature review, the anticipations about stigma. So sometimes a person may have their own inferiority complex towards their condition, and they anticipate more of a problem than it may be, but it still stands that there is prejudice, but some of it may be, you anticipate it because you've gone through it so much. So that was part of their discussion within the article. So, as a conclusion, despite the extensive amount of effort undertaking within the research, it shows that patients still experience stigmatizing behavior even though they are already in community mental health care settings, which was developed as a quest for a socially acceptable, empowering, and stigma diminishing mental health care. According to the research, the results did prove a biased view of stigmatism, um, but it still stands that there is stigmatizing behavior there. There are healthcare professionals that are respectful in the care of their patients, and they do take their ability to want to be independent into consideration. And the review also serves as an illustration to the assumption that the inclusion of the patients with schizophrenia in society is not without risk when considering stigma, and that a community mental health care ought to offer far more than medical treatment. And this concludes a summary of the entire article entitled Stigma in Patients with Schizophrenia Receiving Community Mental Health Care, a review of qualitative studies by Annalene Mesta and Bart Hansen. Thank you and have a good night.